Good afternoon. How are you? My name is Elian Ramos, and I'm your host today. I am here because we are going to be celebrating Hispanic Heritage Month. Today is the very last day for Hispanic Heritage, and we have had so many celebrations this whole month. But today, our show is about celebrating the people who do so much every day to make sure that people are enrolled in healthcare. So we're going to be celebrating the people who belong to the the Affordable Care Act Latino Coalition. And I've been part of the Latino Coalition for since the beginning, and I'm very honored to be part of it. I've been trying to help out, but along with the work that I've been doing, there's so many organizations that have been chipping in to make sure that all Latinos get covered. And those organizations include Enroll America, Families USA, Farm Workers Justice, Hispanic Federation, the League of United Latin American Citizens, the National Association of Hispanic Nurses, the National Council of La Raza, the National Hispanic Medical Association, the National Immigration Law Center, the National Institute of Latino Reproductive Health, the National Urban League, the Planned Parenthood Federation of America, and Voto Latino. Of course, we have a lot more partners all over the country that we work with throughout the year to make sure that everybody has the right information and that people can get involved. And today, I have a very special guest who is going to be talking to us about all of the different activities that are going on, not only for Hispanic heritage, but also as we head into the new enrollment period that begins in November. So I have here with me Janet Contreras, who is from the Office of Communication at CMS. Janet, how are you? Welcome to the show.
Thank you, Elian. Thank you so much for inviting us to come. And it's my pleasure here to represent the Centers for Medicare and Medicaid Services. We're what I call the health insurance branch of the U.S. Department of Health and Human Services. So we're also part of the Latino Coalition, is part of one of my roles that I play in the Office of Communications. And I'll just tell you a little bit about our role. So the Centers for Medicare and Medicaid Services, we call CMS. We basically run the healthcare.gov website, which is also the cuidadodesalud.gov. We provide a ton of resources, which we have on our partner-facing website, which is marketplace.cms.gov. And I hope y'all can see that on my tagline right underneath my name. CMS couldn't fit there, but I thought I'd plug that website. That's the one where we basically direct all of our assisters, we direct all of our partners, anyone who wants to help us spread the word. We have a wealth of information there for them. I will also say that because we are the federal government, we offer a lot of resources in print, and a lot of people don't know that. So a lot of our handouts, fact sheets, postcards, posters, things like that are available for ordering, and we deliver them to you for free. Of course, there are quantity limits, but it's really easy to go through, and on that marketplace.cms.gov website, you can find out how to order them to have them delivered to you in your homes, in your communities. And so that's just one service and our role in what we do in the Affordable Care Act and the health insurance marketplace implementation.
And you do so much throughout the year beyond the Affordable Care Act work, obviously. So let's talk about this. In the beginning, I mentioned that today is the last day of Hispanic Heritage. And you know, the question always comes up, like, why is it so important to take culture into consideration when you're trying to reach out to Latinos about healthcare? I mean, it doesn't, it's not something like specifically obvious.
Yeah, well, I think it's important to provide information in a culturally appropriate manner. But almost more important is making sure that the messenger is culturally appropriate. So it's one of the things that we see is that our communities want to get their information from a trusted source, from a trusted community source. And so this is where cultural, heritage really comes into play. The community leaders in those communities know their communities better than anyone. And it's for us to be able to reach them so that they can help to, share these messages, share this information with their community. I'll say one thing that we do because we recognize this, is that we provide federal funding to support a in-person assister navigator program. It's what we call our navigator program. Those are our in-person assisters that are all over the country. They're working in coalitions and cities all across the country to be in the community to do two things, both health insurance education and outreach and the enrollment. So we actually also train, so since the Centers for Medicare and Medicaid Services, my agency, does the training, and all of that is done online, and we do the certifying for the organizations, we also have volunteer organizations that do that on in-person enrollment assistance in the communities as a volunteer, in addition to the services that they provide in the community. So in a lot of ways, it's like the food banks in your community that are already doing, reaching out to those communities that might be uninsured and need that assistance. So those people have come and stepped up and become volunteer, what we call certified application counselors. And so if your organization is already doing this, thank you so much for all of the volunteers out there who've become certified application counselors. And if you are in the community and you get a lot of questions about how to find health insurance, like what is this all about, I would encourage you to consider offering it as an additional service to your community members, to your clients or constituents. And it's really easy to sign up to become a certified application counselor organization. Again, you can go to that website. You see there, marketplace.cms.gov, and click on training, assister training. And so that's where you find information on how to do that and volunteer.
Mm-hmm. And so as part of the coalition, what would you say is the biggest barrier you have found in trying to reach out to Latinos out there?
Well, definitely the biggest challenge is that people don't know, they're not aware of how affordable health insurance is and all of this. I mean, we find more and more again that statistics tell us 60% of people are confused about how the premium tax credits work, or don't know that they're available. And so that's our biggest education challenge in terms of educating the public about the affordability of health insurance. It's one thing that our navigators are helping to reach out to in the community. And so I feel like I want to give you a little bit of stats here, because this is what I do. When we talk about the uninsured, to sort of understand the challenges, I think it's important to look at this, at what we know right now about who the uninsured are. So there are 10.5 million uninsured Americans who are eligible for marketplace coverage in this upcoming enrollment period. Mm-hmm. Almost half of those are young adults from ages 18 to 34. Mm. And almost 40% of the uninsured who would qualify for a marketplace plan are living between 139 and 250% of the federal poverty level, which is about $34,000 to $61,000 a year for a family of four. So, thinking about this, and approximately 1/3 of the uninsured are people of color. So approximately 19% are Hispanic, 14% are African American, 2% are Asian American. So again, these are the challenges of, the majority of people are eligible. They would qualify for financial assistance. We just need to do more in terms of educating people about how easy it is to qualify for financial assistance. And I always tell people it's as easy as household income and family size. That's all you really need to know in order to know what you can qualify for. And in 2015, as another statistic, nearly 80% of marketplace shoppers on healthcare.gov got coverage for $100 or less after tax credits.
Wow.
So yeah, it really is. I think that's the barrier, is that people don't really understand how affordable it could be.
Mm-hmm. And yeah, we know how, and you mentioned that how statistics are so important, right, to put things into context. But we also know that the coalition has been working so hard out there to make inroads into, educating people and making sure that people understand, one, the importance of getting insured, but also the resources that are at their disposal, right? So can you, we also know that in the beginning, there was a little bit of, some barriers, like you mentioned. It took a little bit for people to kind of catch on, right? But do you have current numbers? Do you have any of those statistics now as to how many people have enrolled? How many people have actually responded to these messages that you're putting out there?
Yeah, actually, I feel like that's the best news I always like to share. I always say we've enrolled 7.6 million and counting. So of the 17.6 million people, 4 million of those were Latino adults. You know, when we look at who's been enrolled, we see 2.2 million young adults between the ages of 18 and 34 have been enrolled. Women were also big winners. In the ACA, more than 4.3 million women ages 18 to 64 signed up for healthcare.gov. And the big message here that I think I'd like to share is that the uninsured rate for Latinos has dropped dramatically, 11.5 percentage points from the beginning of open enrollment, the first year, October 2013, until now. So that's an incredible drop. We started out at 41.8% uninsured and have ended up at 30.3%. So.
Very cool, very cool. Well, it's a testament to the hard work of all of our coalition members out there in the larger coalition, right? There's so many different groups that are working in their respective communities to do this. And so as we head into the next enrollment period, you know, we know there's people out there who are watching and may not know what they need to do to get ready. What are some of the things you need to keep in mind, you know, dates and documents and that kind of thing, so that they can get ready to get involved?
So we have a great resource for that. So people can sign up on our healthcare.gov or cuidadodesalud.gov to get marketplace updates. So if you go to healthcare.gov/subscribe, you can sign up to get email alerts and text alerts on what you need to bring, reminders on when new tools are available, reminders on you know, to make your appointment, to select your plans, things like that. And even if you, so it's a great way. The first thing I would tell people is just to sign up to subscribe for the email and text alerts. And you can just do that by going to healthcare.gov.
Very cool, very cool. And also in terms of not just the Hispanic heritage, because today is the last day. And by the way, there's so much going on online. If you're online, you know, just follow the hashtags HHS 2015, HHS Salud, no, HHM Salud, and Our Salud. There's so much going on all over the internet today, especially on Twitter. So if you can follow those hashtags, that would be, it's going to be a lot of fun, and you're going to learn a lot about what's been going on with healthcare and Latinos in particular. So what kind of other activities, online and offline, does the coalition have as we go into the next enrollment period?
Well, one thing that we're going to, I'm sure, see a lot of are the Latino enrollment events. So we did a large number of those Latino enrollment events last year, and they were extremely popular because they do, again, both things. They raise awareness, they increase the education about health insurance, and they help people to get enrolled. So yeah, we hope to see more of those Latino enrollment summits.
They're a lot of fun too. You can come with the whole family. It's like spend the whole day, the pasadilla, you know?
Yeah.
So those are really, really fun. I've been to a couple of them and I enjoy it myself a lot. So as you know, there's our friends who are watching are all over social media. What are some of the things we can do to support what you are doing at CMS and what the coalition is doing?
Well, I do kind of have a particular thing I think is really important. Some of the folks that are not on social media and that are not on the internet don't know where to find help in their communities. And we cannot stress enough how important that is for people to get enrolled. So I want to let people know that we have a website where they can find where the local in-person assisters are. There too. There's findlocalhelp.healthcare.gov and ayudalocal.cuidadodesalud.gov. So if you could do one thing that to have a big impact is to look up 2 or 3 community organizations that are doing that enrollment assistance in your community, post it on a postcard or put it on your community board, your community bulletins, your church bulletin, and let people know where they can go, because that is it. And you know, we love that the young people are on the social media. So if all you young people want to go to findlocalhelp.healthcare.gov, find a local community organization, volunteer to help them do the enrollment assistance, volunteer to help them put on an enrollment event, and then take that information, their address, their phone number, the phone number of the navigator, whoever's doing the enrollment assistance, and pass that out. So share that information.
Very cool, very cool. And as I mentioned before, if you are online, also follow the hashtags on Twitter that I mentioned before. So it's HHS 2015, HHM Salud, and Our Salud. So those three hashtags have a lot of activities going on, not just now during Hispanic Heritage Month, but as we go into the next enrollment period, that's where you're gonna find all of the information that you're gonna need that you can share also with your family who's not online. And so we have come to the conclusion of our hangout. This is a very short, we wanted to keep it short and sweet. And I want to thank so much Janet for being here. Janet, you have been amazing. Thank you for all of that information. And thank you so much to the Latino Coalition members who are out there. They, unfortunately, there's so much going on today that everybody had a lot of things to do. But Janet is a trooper. Thank you so much for being here. And thank you all so much for watching. I will see you the next time.
Thank you, Eliane.
Ciao.
Ciao.